Importance of body mechanics. As a caregiver, you will be assisting many of your patients with transfers. It is of the utmost importance to use proper techniques and body mechanics when transferring your patients in order to avoid injury and ensure safety for both you and your patient. Keep a wide base by placing feet shoulder width apart. This provides balance and stability. Bend your knees and keep your back straight. This helps you to use the stronger leg muscles for the work, not the weaker back muscles. When lifting, keep the patient weight close to your body. Point feet in the direction of the weight, never twist your body. Safety considerations. Before beginning any transfer, you need to first assess the patient, their ability to help, and their estimated weight. Determine whether assistance from a second person is needed to complete the transfer safely. Before any interaction with the patient, you must first wash your hands. Be aware of patients' abilities and disabilities. Have any supplies and equipment needed for the transfer ready before you begin. Inspect the equipment. If transferring to a wheelchair, confirm the brakes are in working order. Keep surfaces level for easier transfer. If you are transferring from a bed to a chair, they should be at similar heights if possible. Lock the wheelchair brakes. Make sure the patient is dressed appropriately. They will need to be wearing shoes or non-skid socks and any prescribed braces. Baggy clothing and pants should be secured or tightened with a belt. If permitted, place a transfer or gait belt around the patient for the protection of the patient and the caregiver. Communicate to the patient who you are and the plan you will use for the transfer. Moving a patient. Rolling to a side-lying position in a bed. Roll patient by putting pressure on their joints, at the knees, hips, and shoulders. The patient should bend the leg opposite to the direction they're rolling and reach across their body to assist you with the roll. Sitting up in bed. Roll the patient to a side-lying position, bring legs over the edge of the bed, and have the patient help as much as possible while you assist them into a sitting position. Be sure to use good body mechanics by lifting with your knees and not twisting your body. Have the patient dangle their legs and feet off the bed. Observe the patient and ask how they are feeling. Are they in pain or lightheaded? If so, help the patient back down. Transfer to a wheelchair. You will need to know whether the patient has a stronger side and transfer to the stronger side. Position the wheelchair, set the brake, and remove the arm and foot rests. Communicate the steps you will take in the transfer. Help position the patient on the edge of the bed. Have the patient hold onto your shoulders or waist, not your neck. Grasp the transfer or gait belt if used, and while using good body mechanics, on the count of 3, bring the patient to a standing position. If a transfer belt is not used, grasp the patient around the chest under his or her armpits and clasp them in the back. Never pull on their shoulders or arms. As a note, you may need to block or position yourself next to the weak side leg with your knee or foot to prevent the extremity from dragging or buckling during the transfer. Rock side to side or dance with the patient as you turn the patient's body, positioning him or her in front of the chair. Pivot, do not twist. Have the patient reach back to the armrests and hold on to the wheelchair as you lower them into it. Keep your back straight, slightly lean forward, and bend your legs as you lower the patient. Reinstall arm and foot rests onto the wheelchair.